Which sleep disorder should we start with?
Sleep apnea and insomnia. Sleep apnea, for folks out there who may not know what it is when you are snoring at night. Almost everybody who has sleep apnea snores. Not everybody, but almost everybody. And when you're sucking air in, you pull your tongue to the back of your throat and you cut off your air. And you literally stop breathing, right, for a few seconds. Then all of a sudden you make all this kind of grunt and groaning noises, and then you wake up. This can happen hundreds of times a night. And it can be very problematic because, of course, it wakes you up every single time that you have one of these events, right? And so as an example, we measure the events per hour. So as an example, somebody with sleep apnea could have between 5 and 15 times per hour that they stop breathing, and that's mild.
So how are they going to get into the deep sleep that clears out the brain?
That's the problem,
okay.
Right? And so apnea prevents them from getting into a lot of that deep sleep, and so their brain doesn't clear out, and then they're kind of screwed. So at the end of the day, the goal here is to get as many people to, number one, identify if they have a sleep disorder, and then be able to try to figure out what to do about it. And the percentage of people in the US that have undiagnosed sleep apnea is pretty big. It's like somewhere between, I think, like 18 to 20%.
This is crazy. I was just looking at the stats. It says, according to 2026 data, approximately 936 million people to 1 billion adults worldwide have obstructive sleep apnea, which is what, 1 in 7?
Yeah, that's about right.
Making it as common as diabetes. 1 in 7
Correct.
people listening have sleep apnea.
Yes.
Wow.
As popular as diabetes. Let that sink in for like half a second. Everybody knows what diabetes is. Almost nobody knows what sleep disorders are, specifically sleep apnea.
And it says 80 to 90% of those people remain undiagnosed.
That is
Whoa,
correct.
Wow. So there's people listening there's actually a huge percentage of people listening right now that have sleep apnea and have no idea that they have it.
Exactly right.
How would they know?
Do the sleep test.
This thing here?
Yeah.
And what would this show?
So this actually collects what is your oxygen levels throughout the night, what is your heart rate throughout the night, how many times do you actually stop breathing, and also the depth of your sleep, which stages of sleep you get when you fall asleep, things like that.
And what would this, so because people are going to be sat there, well, like, how do I know if I need to do the test?
So great question. So you want to think about the symptoms that you might have. So do you snore? Do you wake up gasping for air? Has anybody told you that your snoring stops for brief periods of time, or that they've heard you gasping for air? Do you wake up with a headache in the morning? Do you find your moods are up and down? All of those are signs and symptoms of sleep apnea.
And this test, are you affiliated with this company at all?
I am not, but we do have that test on my website. We sell it to people so that way we can test them.
And how much does it cost?
$189.
Okay, so it's not.
It's not exorbitantly expensive, and it also is covered by insurance.
And it connects to an app?
Absolutely. So you'd put it through your sleeve?
So I'd put that there and then like this?
Yeah, exactly. And that's it. You go to bed, wake up, then the information ports over to your phone, and then tells us exactly what's going on. Now, here's where it gets even better. I know, right?
Can you imagine me getting in bed with my fiance and being like, come on, babe,
We're recording all kinds of good stuff. Who knows what she might like?
Is this going to help my sex life?
It's absolutely it will, because getting into bed and knowing how well you sleep and knowing if you have sleep apnea or not will definitely affect your sex life. Also, by the way, I've saved more marriages as a sleep doctor than I ever would have as a marital therapist, dealing with snoring in the middle of the night and things like that. So you'd be surprised. But what's nice about this is it's one night. You don't have to do it multiple nights. It's super easy. And again, believe it or not, that's disposable. You can actually throw that whole thing away after it's all said and done.
And on that point, before we just go a little bit further into sleep apnea, should we be sleeping in bed with our partners? And I know that's an interesting thing to say.
Great question. The strength of your relationship has nothing to do with where you sleep, okay? So lots of people are like, I gotta sleep with my partner, otherwise my relationship's gonna go to shit and everything's gonna go terrible and we're never gonna have sex and we're blah. Not true, okay? So a lot of times for people that I have, so for example, I've got people who have sleep apnea and they use a machine to help them sleep called a CPAP machine, right? And that noise for some people can be disruptive. And so they sleep, let's say, in a different room, right? So is that detrimental to your marriage? No, it's not. Because here's what you do, is you vacation on the weekends in your bedroom. Right? I can't count the number of people who sleep separately during the week and then together on the weekends. And it turns out that they get much better sleep during the week. And then guess what? Intimacy shows up much faster on the weekends because they're not so tired. Used to be, not tonight I have a headache. It was really not tonight I'm exhausted. When you allow your partner to get good sleep during the week, there's a reasonably good shot that you're going to be able to be intimate over the weekend if they got good sleep. So wearing that to bed might not be the sexiest thing in the universe, but it's better than having sleep apnea and eventually ending up dead.
Are the symptoms of sleep apnea different for men and women?
They are. Great question. So it turns out that men and women are quite different, but we've historically been scoring them the same. So women don't have a tendency to have as much snoring as men do. Women have a tendency to have more arousals where they wake up constantly. Women have a tendency to report headaches in the morning more so than men do. So it's actually different types of symptoms for women versus men when it comes to sleep apnea, to the point where we're now considering using different testing devices. So this testing device would not necessarily measure EEG, and in women, EEG might be important. That's what we're learning. So as an example, our company is finding a device specifically to send to women so that way we can more accurately measure sleep apnea in women. Now, there's a lot of questions about treatment for sleep apnea, and the biggest reason why nobody gets sleep tested is because they're afraid that they're going to end up sleeping with a CPAP machine on their face at night. And so let me describe to your audience what that is. Also, full disclosure, I have sleep apnea. I don't look like somebody who has sleep apnea. I stop breathing in my sleep. I think it's 26 times an hour. I know, right? Kind of crazy. And I wear a CPAP machine and it helps me sleep every single night. Let me explain what it is. So when your throat closes here, CPAP machine is a little air compressor with a tube and a mask that sits on your nose, pushes a just thin stream of just air. And when it hits that blockage, it ever so slightly opens it up, shoots air straight down to your lungs. Now you might be saying to yourself, that sounds barbaric. That is insane. It's a hairdryer blowing up my nose all night long. Here's what I can tell you is when you have a severe case of sleep apnea, this can be a lifesaver. This can be one of the biggest, most important things that you possibly do. Now, a lot of people say, oh, I don't think I could sleep with a mask on my face. Well, that's not the only treatment. There are other treatments called oral appliances. This is like a mouth guard, like you see the footballers wear, but it's an upper and a lower, and the lower slowly brings your jaw forward, which opens up your posterior airway space. The same way that air pushes things aside, the oral appliance structurally moves your jaw slightly forward, thereby opening up your airway. So that works well, and then there's no mask on your face. There's a third device that you can wear on your tongue that vibrates, that shrinks your tongue by a couple of millimeters, which opens up this posterior airway space and allows you to breathe better.
Have you tried all of them?
I have, as a matter of fact.
And why did you choose the apnea machine?
So for me, the apnea machine worked the best and made the most sense for me right now. But I'll be honest with you, I will probably get the mouth guard for when I travel. There's a lot that can be done out there. And by the way, there's also surgeries. And surgeries are a little bit more permanent fix, but in many cases, those surgeries can be quite effective. Also, by the way, they're working on a pill for sleep apnea now. And that's just apnea. We haven't even talked about insomnia yet.
I was just reading about the FDA approving a drug.
Yeah, it's quite remarkable. And there's actually three different companies that are working on different drugs right now for sleep apnea. And I mean, to be clear, when that happens, I think it's pretty much game over for sleep apnea, right? I mean, once we can get it in a pill form, which means compliance increases dramatically, we can help a lot of people with sleep apnea, which I think would be pretty amazing.
And women are heavily undiagnosed, right? Because we think of it as, I mean, I've heard it being referred to as a sort of an old man's disease.
Yeah, absolutely. And here's the thing. Many women have a tendency to report insomnia types of symptoms over sleep apnea types of symptoms, when in fact, they actually have undiagnosed sleep apnea, which we can catch.
We talked a little bit earlier, but from many of the conversations I've had on the show about Alzheimer's,
yes,
your chance of getting Alzheimer's, I imagine, is going to increase, right? Because
absolutely,
you have sleep apnea.
Yeah, well, because when you have sleep apnea, it keeps you out of the deeper stages of sleep. The deeper stages of sleep is where that lymphatic system comes in and scoops out those proteins, and that's really probably one of those big causes for it. So that's one of the things that we always want people to understand. But there's also something else that I think is important to maybe talk about, which is on the other side, not sleep apnea side, but on the insomnia side, which is there's a lot of people who go to the drugstore and they buy an over-the-counter sleep aid, right? Now, I'm not talking about supplementation yet. We can get into supplements in a minute if you want to, but I'm talking about things like the PM medications, right? Here in America, we have them where there's like an analgesic plus a PM. So there's Tylenol PM, Advil PM. And what it is it's a pain reliever, but they add something called diphenhydramine, and it makes you feel sleepy and it makes you fall asleep. Diphenhydramine is actually an antihistamine, right? So it's used for congestion and things like that. But there's now data to suggest that daily use of the PM part of this, not the pain relieving part, but the PM part, can lead almost directly to Alzheimer's.
Oh, wow.
Right. So if people can just go to bed and follow a couple simple rules and go to bed naturally, you'd be shocked at how much better your world is going to be.
The Queensland Brain Institute at the University of Queensland found that people with untreated apnea have a 45% higher risk of developing Alzheimer's disease.
Like I said.
Which is crazy.
So
it's really important.
Here's the thing is we've got all these people who are watching your show right now. They need to start thinking in their head, like, maybe I have sleep apnea, maybe I don't, but maybe I should take a look at what are some of the symptoms and see if that's something that could be going on for me. Because again, testing is available. And to be clear, it's not like I'm the only guy out there testing people. I mean, there are sleep doctors all over the world that are testing people. My encouragement to people is, hey, figure it out. If you can't figure it out, shoot us an email. We'll find a sleep center for you to go to. But if you think there's something going on, it's definitely worth checking out. Because by the way, you can stay with undiagnosed sleep apnea for your entire life. And all it does is basically break down everything that's going on inside. And that's not what you want. Like, remember, sleep is recovery, right? This is how your body still functions. Like, if you want to lead a nice, prosperous life, you want to sleep.
Insomnia has become a bit of a word that people throw around.
For sure.
Right? They kind of self-diagnose themselves. We kind of think of it as this one specific thing. I think people say, I have insomnia when they just don't sleep well.
Right.
What is insomnia and what's the big myth around it?
Yeah. So number one, there's a couple of different flavors of insomnia. There's the I can't fall asleep. There's the I can't stay asleep, which we talked about quite a bit. There's the I wake up too early. And then there's just the I wake up from unrefreshing sleep. So we really think that there are four sort of types of insomnia, right? And when people, I would say some of the biggest myths that a lot of people have surrounding insomnia is, or like the biggest problem that they do is when somebody has a really crappy night, then what they try to do is the next evening go to bed early and try to catch up on some of that sleep that they missed. So to be clear, this is a terrible idea because your circadian rhythm isn't ready to go to bed early. So you lie in bed and you're exhausted, but you can't fall asleep. You're what I call wired and tired, right? And so what we want people to do is if you do have a bout of insomnia where you have difficulty falling asleep or difficulty staying asleep, number one, don't over-caffeinate during the daytime. So many people are like, oh, I'm dragging, I gotta get a coffee, and they caffeinate, and then they caffeinate so late into the day that they have shitty sleep that night, and now we're in the washing machine cycle going over and over and over. It sounds like you might be relating to this a little bit maybe yourself. And then, so we wanna avoid that. The other thing we wanna avoid is overstimulation at night, right? So a lot of times people get that nervous energy, and so they're just doing. Again, you need runway to land the plane, so give yourself some kind of that space. And then just make sure that you've got some level of regularity. I would argue for my insomnia patients, but quite honestly, for anybody who's watching this, the number one sleep tip that I can give people is to wake up at the same time 7 days a week. Not go to bed. I don't actually care when you go to bed that much. I know there's a lot of sleep specialists out there who are like, you gotta go to bed at the same time and wake up at the same time. I'm not of that ilk. I don't really care that much about the going to bed time. I really only care about the wake up time. Let me explain why. When you wake up in the morning, sunlight hits your eye and you have a special cell in your eye called a melanopsin cell, which sends a signal to your brain to turn off the melatonin faucet in your head. But it sets a timer for exactly 14 hours later. It's called the melatonin phased response curve. So if you're waking up at 6, melatonin turns off until about 8 p.m. Then it takes about a couple of hours for it to get up and in. So then you start to get sleepy around 9:30 and you go to bed. But if you did that and now it's Saturday and you sleep in until 8, melatonin doesn't kick off until 10 Saturday night. So what I'm saying is the time that you wake up directly determines when your internal melatonin kicks into gear. So if everybody woke up at the exact same time every single day, 7 days a week, automatically you would get tired at the right time and you would start going to sleep.
And is there two different types of insomnia? Sometimes I hear primary, secondary insomnia. I think I heard that on your YouTube channel.
So when you look at primary insomnia versus secondary insomnia, the way we categorize that, secondary insomnia is usually due to something else that's going on in your life.
Psychology.
So maybe caffeine abuse,
Oh, okay.
right? Maybe something along those lines. Whereas primary insomnia is there's nothing else. The only thing you've got going on is sleep disorder. Another example of something where insomnia might be secondary would be pain. Right.
Okay.
So if you have a pain syndrome, if you have fibromyalgia or low back pain, that could prevent you from sleeping. That would be secondary insomnia, secondary to pain.
And I hear that the most common treatment for insomnia is CBT therapy?
So yes and no.
Okay.
So I would say that the most common therapy for insomnia is alcohol. More people drink themselves to sleep
Right.
than any other single thing out there. And then you start to get into the pharmacy of it all. And there's a lot of pharmaceutical drugs out there that people utilize for sleep. And I want to make a point, if I can, is there's nothing wrong with needing a pill to sleep. Okay, I want to be very clear about this. There are people out there who need pills, right? All kinds of different ones. Thank you. There's a whole host of reasons why you and your doctor may have come to the conclusion that a sleeping tablet is good for you. The problem comes when those sleeping tablets are overprescribed. So insomnia is, in the sleep world, we call it a door handle diagnosis, because when the doctor has their hand on the door and they're just about to leave, that's when the patient says, oh, and by the way, I'm not sleeping. And then the doctor usually pulls out the prescription pad and says, Ambien or Trazodone or something like that, writes it up, says, here, come back in 30 days. Well, you haven't really done anything for this person. You've handed them a pill. And by the way, now they're probably either psychologically or physiologically addicted to said pill, right? Now, once again, if you've got a major mental health issue, I don't think I care. I think it's okay for you to have your Ambien and be fine.
And a lot of people that do have insomnia have depression.
Oh, I think it's one of the biggest things that we see. But I would argue anxiety might be a little bit more than depression. But yes, anxiety and depression, I would argue, make up 75% of insomnia at any given time, right? I work with people and I do something called cognitive behavioral therapy for insomnia, which you correctly identified as CBTI, right? And so I work with patients all the time. And that's exactly what we do is we reschedule them. So that's the behavioral part. And then the cognitive part is we talk to them about how do you think about sleep? Because a lot of people think about sleep in disastrous ways. They're like, if I don't get 8 hours, my whole day is screwed and everything's going to happen. It rarely happens that way. Like, it's called catastrophizing. You just make it worse and worse and worse. And so we look at those cognitive distortions and we help fix them in therapy by really kind of what I call doing the math. And so I say, well, have you ever had 4 hours of sleep? Yes. Did you do something terrible the next day? No. So where's your evidence? Right? And you start to get people to challenge themselves, and all of a sudden they can kind of get there. There's also another area of that a lot of people go to somewhere in between the pills and therapy, and that's supplementation. So there's a lot of people out there who like to use supplements and try to understand how to fix, quote, their insomnia with supplementation. So if we can, let's talk a little bit about supplements and sort of what's good and what's bad.
What is the difference between a supplement and a pill? Or is it you talking about the same thing here?
So under the context of this conversation, a supplement is a non-FDA regulated thing that you can purchase at any drugstore. And a pill is a by prescription only from a doctor.
Okay.
That's how we're going to make the distinction for this particular conversation.
Okay. So those pills that are in front of you
So
there.
right in front of me, these are actually all supplements. So these are different things. So these are not pharmaceuticals. These are different things. So we've got...
I mean, in different countries, it's different, right?
Great point. So let's talk about melatonin, since that's kind of the biggie that a lot of people like to know about. So number one, melatonin is by prescription only almost everywhere other than the United States, right? So in England, in Australia, in Europe, you can't just walk into the drugstore and buy melatonin. And there's a reason. A lot of people don't realize it, but melatonin is a hormone. There's a reason you can't go to the CVS and get testosterone and estrogen, right? Because hormones affect the entire system. They affect almost 300 different things in your body. So what you don't want to do is have somebody just willy-nilly grabbing a hormone and starting to pop it without somebody understanding what's going on with them. More importantly, melatonin in particular, and the point I wanted to make earlier about depression, melatonin interacts with all SSRI medication. An SSRI is a serotonin-specific reuptake inhibitor, an antidepressant. So things like Prozac, Zoloft, Celexa, All of those are medications that will be affected by melatonin ingestion, and nobody knows that it is. In addition, melatonin affects birth control. Yes, you heard it here. Birth control. It affects blood pressure medication and it affects diabetes medication. So one of the problems is that people go into the local drugstore and they're like, I'm going to grab some melatonin and I'm going to make my sleep better because I'm sleeping poorly. So first of all, that's not what melatonin does. Melatonin is a sleep regulator, not a sleep initiator. Melatonin doesn't affect sleep drive. Melatonin affects sleep rhythm. So remember in the beginning of our conversation, we're talking about the two systems. Melatonin only affects your brain telling it when it's time to go to bed. It does not make you sleepy. That's adenosine. We already talked about adenosine and caffeine and how similar their molecular structures are. So when you look at something like melatonin, you need to really be thoughtful about using it. Number two, melatonin is not to be used in children, okay? So a lot of people are like, Michael, I've got pediatricians all over the country telling me to give my children melatonin. I'm gonna say it right here in front of everybody. That is the dumbest idea I have heard in a long time, because you just taught your child that they need a pill to sleep. Normally, no child needs pills to sleep. And by the way, most children make almost 4 times the amount of melatonin that their brain even needs. So giving them extra melatonin doesn't do you any good. There is, however, one group of children where melatonin does work well, and that's in kids on the autism spectrum. We don't know exactly why, but or at least I don't, but there is data to suggest that at 5, 6, 7 milligrams, that can be very helpful for them. Dosage also is a problem. Like if you go to the drugstore, you almost can't find it in the appropriate dose. The appropriate dose is anywhere from about 0.5 milligram to 1.5 milligrams. Maybe top out at 3, but that's about as high as you want to go. But when you go to CVS, you find the gummies in 10 and 20 milligrams. And people tell me all the time, I can't take melatonin, it gives me crazy dreams. Number one side effect of overdosing on melatonin is crazy dreams.
On this point of going to a supermarket and picking some melatonin off the shelf, FDA approval and the lack of FDA approval in melatonin means that there's less clarity on what's actually in there, right?
That's exactly right.
I was reading about a study in 2024 where they looked at different melatonins that were found on the shelf.
And they found very different things inside the bottle.
Very, very different things. They looked at an analysis of melatonin gummies marketed for children and found that the actual amount of melatonin ranged from 0% to 667% of what was listed on the label.
Yep, see it all the time.
And in the same study, some melatonin gummies contained absolutely no melatonin, while others contained hazardous contaminants like CBD that were not disclosed on the label.
Yep.
Because melatonin is sold as a supplement in the US and not a drug, the FDA does not test it for safety or accuracy before it hits the shelf.
You are 100% correct. And that's a huge problem. Just think about that for a second. I mean, the market for melatonin is tremendous. It's huge in the supplement world, yet there's no regulation whatsoever. Nobody knows about these interaction effects, which are big, big, big. And by the way, most people are using it wrong. There's really only 3, maybe 4 different instances when melatonin would be useful. I would use melatonin for jet lag, and we should talk about jet lag. I would use melatonin for shift workers, right? So for people who work, night shift, who have to sleep during the daytime, they would be excellent people to use melatonin. People with a melatonin deficiency, a lot of people don't think about that, but right around age 50 is when, if you're going to have a melatonin deficiency, we start to see that happening for people. Is it their ability to produce melatonin begins to decline? So I think those 3 situations absolutely would be on board for melatonin. Believe it or not, there's some data to show that in ADD and ADHD, there's some use for melatonin, and then also for a very specific sleeping disorder called REM behavior disorder.
We're going melatonin crazy as a society, aren't we?
Absolutely. We don't need it. It's completely unnecessary.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.